And together, we will move mountains. And if they don't hear our message, then we'll just do it over and over and over and over 1,000 times again for you. And I'll rise up, I'll rise like the day, I'll rise up in spite of I will rise, we will rise, we will rise, we will rise.
Hi, everyone. My name is Michelle Zabel, and I'm an Assistant Dean at the University of Maryland School of Social Work and Director at the Institute for Innovation and Implementation. As you all know, this year of working virtually has necessitated some really creative approaches to conferences. We've spread the training institutes out over the last 9 months, just a few workshops each month. And I just want to personally thank you for joining in these discussions. These workshops have been so much richer because of you sharing your experiences and ideas to meet the needs of children, youth, young adults, and their families. So today, I have the exciting opportunity to remind you of some general housekeeping items. Even in a virtual world, they don't let me out of this part. Our workshops are being recorded, and your participation does imply consent. Also, please remember, if at any time you need help in navigating through the virtual spaces or accessing the links to workshops, we have a live help desk chat that is being monitored during the duration of the entire workshop. Our team is posting the link to connect with the live help desk in the chat box now. During all the workshops being offered throughout this series, I really want to encourage you to actively participate by using the chat to post your questions, any comments, and any resources you want to share with your colleagues. Our presenters absolutely want to hear from you, and we know your participation makes the workshops even better. We have staff monitoring the chat in Zoom and on YouTube, and they'll be assisting with facilitating the questions to the presenters and making sure that the presenters' resources are shared with you. So finally, there'll be an ASL interpreter available throughout the workshops. Interpreters will be shown on your screen, and they can be pinned for those who require interpretation. So you want to hover over the video and select the 3 dots. One of the options that appears is pin video. So by selecting that pin video, this video will now not move out of view. This summer, we are continuing the training institutes in a way that will allow you to take us wherever you go. So hopefully you're getting to take a break, a vacation, and get some relaxation. We're recording our summer workshops and releasing them each month so you can watch them anytime during the month that actually works for you. These workshops are on a wide range of topics, all focused on strengthening your skills as you support youth and families. While you're enjoying these summer workshops, we're going to be planning and working towards future training institutes, and hopefully we can all see each other in person. Thank you so much. Take care and enjoy your summer.
Welcome, everybody. This is Bob Lieberman, and I'm going to be introducing now our other speakers today. I'm president of Lieberman Group and chair of the Outcomes Workgroup of the Building Bridges Initiative. And with me today are Nancy Craig, who's the director of community and system engagement for Families Together in New York State. Jennifer Outlaw, who is the executive vice president of Child, Family, and Community Services at the SEO Family of Services in New York. And William Martone, Bill Martone, who is the president of his own consulting firm, WPM Consulting, former CEO of Hathaway Sycamores in California. Next. So today we're going to do a few things. We're going to give a brief overview of the Building Bridges Initiative. Some of you may be familiar with the initiative. We're just going to cover that briefly. We're going to weave throughout the discussion of the impact of family member and youth partnership when we're measuring. This workshop is about data-driven practices and tools. And then we're going to define those tools that we've developed at BBI for assessing practice indicators, for assessing point-in-time functional outcome indicators, and for assessing provider readiness. And we'll finish with just a couple of comments about the next steps in our measurement agenda. Next.
Thanks, Bob. So as Bob said, I'm Nancy Craig. I work for New York State's family-run organization, statewide family organization. And I'm going to talk a little bit about why families feel that it's so important to have measurement in residential interventions. So next. Oops, I guess we can go back. It's just on my slide. So why is it important? Well, you know, we have a universal language and we have a universal vision. And our vision for families is about what if we could only think about what the change could be for our family. Not just my family who had and used residential, but for the thousands of families. The creation of BBI 16 years ago gave us all, parents, caregivers, providers, and especially the system, a framework of common language to build upon. We came together as one solid, unified voice that says, what if residential looked different? And we had a great leader at that time, Gary Blau. Dr. Blau he's the one who said, what if? He put that in our minds. So the process was developed to figure out what works now and what could change. Lots and lots of national associations, Social Workers Association, ACRC, they were looking for a change. They knew what we had didn't really work well. They were looking for something different. My family got care for a number of years. We don't do that anymore. It was a placement. It wasn't an intervention. So I say to everyone that's listening in today, why do we measure? If success is truly the goal, then why not measure? Take the guesswork out of the what and the why we're doing. That keeps everybody focused on the prize, and the prize is the family and their youth to go on and live without us. That's why BBI is so important. And we really do thank you all for participating and listening and learning what this initiative for interventions, short-term interventions can do to help families in the long term. So next.
Thanks, Nancy. The work with the families is really the central point of what we try to do in BBI. I'm going to talk just for a few minutes about the overall framework that Nancy was referencing. So when BBI came together, which was 16 years ago, as she said, it was designed as there were a whole lot of people, professional and family members and youth in Omaha. And the idea was, how can we bridge the gap between residential, excuse me, and community perspective services and supports for children, youth, and their families? And there's long been a tension between community perspectives and residential perspectives on the work and how can we help young people who are really so much in need of help. So the focus was and remains on transforming residential services and supports through an active partnership with families, not where sometimes we might bring them in to sign a treatment plan, but a real active partnership where families are equal partners with us, and an active partnership with youth where we involve the youth in decision-making in the organization, implementing culturally and linguistically competent practice that links with the community, and that linkage with the community is really important, and trauma-informed care in general. And of course, 16 years ago, we had much less of an understanding of it than we do now. In those 16 years, many organizations and jurisdictions, states, some cities have achieved significant improvements upon implementing aspects of the BBI framework. And the framework is pretty well articulated in a set of performance matrix and guidelines. And there's a link to that and the resources at the end of this slide deck. So we've been influential in policy development, including the recent Families First Preservation Services Act. And we've written 2 books. We put together 2 books, which identify practices for residential transformation that are based on what we're doing with the BBI framework. Next. This is a view of our mission and goals. You see in bold, the mission really focuses on collaborations and partnerships and all these things we want to try to promote through those partnerships. Our goals are to identify and develop residential best practices, to improve relationships between residential and community providers, families, and youth, and to integrate residential interventions into the overall community system, whether it's a formal system of care or just the local community system. So we have a comprehensive array of integrated services to meet the needs of children and youth with serious emotional challenges and their families, meet all of the needs. Next. This is a quick look at our core principles. They don't necessarily flow in the order of the arrows, and you can kind of envision the child and family in the center, but we want to, in our principles, we want to be fostering family-driven and youth-guided care, cultural and linguistic competence, clinical excellence and quality standards, accessibility and community involvement, community engagement, community involvement, community linkage, and transition planning and aftercare services. Next. So there's been increasing amounts of research on residential treatment and specifically, and the research that actually goes back decades shows improved outcomes with some key factors, including shorter lengths of stay, increased family involvement in the residential episode, residential stay, and stability and support in the post-residential environment. So Walters and Peters is a reference on this, and they were summarizing research that really goes back into the 60s and 70s, showing that these factors improve long-term outcomes for kids who go into a residential situation. Next. And we found that there are some critical elements for success. This was identified in one of the books that we just mentioned, and we will show the titles. I saw that question in the chat. We'll show the titles at the end for sure. But these are some critical elements for success. Partnerships, we mentioned that, permanency, comprehensive family engagement, family driven. So the families are not just at the table, but their opinion is given equal weight to the professional opinion. Of course, alignment with families first comes more recently. Moving away from standardized behavioral approaches like points and levels, and using more individualized trauma-sensitive approaches in collaboration with the youth and families. That's a key driver of what we do in the Building Bridges Initiative, youth-guided care, teaching self-regulation. There's a great set of strategies on our website for helping promote using sensory approaches to promote self-regulation, and using data to implement robust quality improvement practices, which is really the focus of our time here with you today. Next. I want to pause for a minute and just talk about the concept and the term residential intervention. So we've begun to use this term. This is actually several years ago, rather than talking about residential treatment, which it's hard to combine. There's treatments that happen within a residential setting, and the treatment is actually very, very critical. And also moving away from residential care, because sometimes staff would see that as we're the ones who care for the kids, not necessarily the families. Of course, that's not always the case. And really moving away from the concept of placement to a form of intervention that can be used in targeted and effective ways. And this is evolutionary research-based practice. And there's been many agencies across the country that begun to experiment with the idea of a residential intervention, which we see the residential episode as a specific intervention, which is inclusive not only of what happens within that residential program itself, which is kind of the historical look. What happens in the program is the treatment, that's what we're doing, but also to now include what happens in the home while the youth is receiving services and supports, and also in the community. So really linking together the home, the community with the residential program. And the concept of residential intervention encompasses the principles of therapeutic residential care. There's a definition out there you can find on the web for therapeutic residential care, and the many different treatment approaches and supports that are being effectively implemented in residential programs, as well as in home and community settings. So it's a broader kind of umbrella, to use the term residential intervention. Next. So BBI has an agenda for data, a data-driven practices agenda. When we started 16 years ago, we established the Outcomes Workgroup to develop tools and resources for assessing, measuring best practices in residential interventions. There's been ongoing work that has evolved iteratively, over the years. And that work has produced several tools, several reports, and several tip sheets. And there are links again at the end that you can get when you access this PowerPoint. I think it's going to be on YouTube that can connect you to that, but you also can get it through the BBI website, and we'll show you that website address several slides down the road here. So the outcomes, the data-driven practices agenda has involved family members and youth all along. We have family members on our outcomes work group. We have youth members on our outcomes work group. One of our first co-chairs was a young person, but we also have preeminent researchers, academicians, quality improvement directors, providers, clinicians, policy fellows, and policy makers who are part of the outcomes work group or have been part of the outcomes work group. The work group has had formal partnerships with some preeminent measurement organizations, including Chapin Hall at the University of Chicago, Doherty Management Associates in Lexington, Kentucky, and of course, the University of Maryland, Baltimore Institute for Innovation and Implementation, who are sponsoring us here today. Next. One of the key aspects when we're looking at measurement in BBI are the processes that our tools call for. So our instruments are designed very intentionally to collaboratively engage family members, youth, staff. It's really a 360 on an organization or on a system, and community stakeholders in all aspects of the measurement process. So we seek to get all those folks involved in the design, implementation, and follow-up quality improvement activities. Again, whether this is happening at the national level, whether this is happening at a state system level, or within an individual organization. That is kind of in keeping with some of our core principles of quality standards, of family and youth engagement, and community involvement. The measurements and tools and processes, we've designed allow them to be customized to an organization or jurisdiction's strength and needs. So it's not a one size fits all. We're working with several different states now, and they're customizing the tools to what their needs are. And that's kind of in keeping with our principle of individualized focus when we're working with a youth and family in a residential intervention. We want the interventions, the plan, the treatment plan to be designed to the individual needs of the youth and family, not a one size fits all. And then in the self-assessment tool, we want to involve all stakeholder groups, and we're going to hear about the self-assessment tool here in just a couple of minutes. Next. So here are the three tools that we're going to be talking about today. The self-assessment tool will be up next, and we're going to spend most of our time on the self-assessment tool, relatively speaking. This is a practice level set of indicators that implement BBI principles. There's a performance indicator and guidelines matrix, been recognized by GuideStar as really instructive, that comprises the self-assessment tool is designed to assess, and the tool comes with an instructional guide and glossary, and you're going to hear more about that here in just a moment. Later on, we're going to talk about a post-discharge outcome survey and what that can and can't do. It was designed to be administered telephonically. We're going to talk about that a little bit more later. It assesses point-in-time functional status. How is the youth doing right now, today? And we have a family caregiver version, we have a young adult version, and we have a Spanish version. The self-assessment tool has just been re-edited, and we will have a Spanish version of that before long as well. And then we have a residential provider readiness assessment, and that tool is for assessing provider readiness across several domains for measuring post-discharge outcomes. So those are the three tools we're going to be covering, and next we're going to go into the self-assessment tool. Next.
So one of the tools Bob just described was the self-assessment tool. And what you're looking at is a snapshot of the paper version of the self-assessment tool. This is a section on the child and family team and is one of 2 pages that really asks a series of questions of respondents to go through and identify their responses in terms of different areas. Next. So what is a self-assessment tool? It's really an instrument designed to be used with groups of residential and community staff, family and youth, parent and peer and youth partners, community partners, funders, as well as others who may interact with the residential provider to assess the activities of the residential provider and its community partners against the best practices consistent with the BBI framework that Bob shared with you a minute earlier. The purpose of the SAT is to help a provider improve services by facilitating quality improvement activities for itself and its community partners. The SAT surveys to the extent to which desired practices are occurring from the time of referral through discharge and return to community with the youth. As you saw on that sample page, it uses a 6-point rating scale. And it really looks at the perceptions of people regarding each of the practices in regards to those 6 points. Are they never or almost never occurring? Are they rarely occurring? Sometimes occurring? Often? Always? Almost always? Or an individual doesn't know or it doesn't apply? So sort of simply expressed, the SAT is really a platform to stimulate conversation. It's designed to spark dialogue and QI activities between participants that have responded to it. And we just want to be really clear that it's not a monitoring or compliance tool and really shouldn't be considered to be used in that format. The tool identifies differences between respondents and gives an organization an opportunity to look at what those differences are. And it focuses collective energy on effective strategies and practices related to better long-term outcomes for youth and families. Next. So why use it? It really provides an opportunity for an organization to create staff development opportunities and training opportunities based on what it's learned through that assessment. There's an identification of quality improvement opportunities that are there within the organization that can be focused on. And additionally, it really stimulates discussions of promising and best practices among staff and stakeholders. We've really found in the use of the tool, organizations really beginning to delve into conversations that really look at the best practices for youth and families that are receiving residential interventions. It also provides an opportunity for feedback from family and youth through this survey. And typically organizations may do exit interviews to present feedback from staff or from youth or from families. But the tool can also be used that way as a concluding experience with an intervention to look at what that experience has been like for the youth or family. Next. So the scope of the survey tool really assesses the supports and services provided to youth and families receiving a residential intervention. So for the purposes of the SAT survey, a residential program is a congregate care program which provides treatment and or supportive services for youth and families. And this is ideally both within the program as well as within homes and communities of the youth and families. So that really means the survey is not just about a residential intervention, but it's also about how well the various community partners work with the residential program and how those supports are provided to meet the needs of the youth and families. The survey is intended to identify practice indicators where there's disagreement between respondents or have not yet been implemented within a residential intervention, so that quality improvement work can really begin within that organization. So looking at where those surveys don't align is really important to understand the differences of perceptions of individuals that have responded to the survey. And again, it's not intended for monitoring or compliance. Organizations have different ways of looking at their compliance, whether that's community care licensing, whether that's accreditation. This is not a tool designed to look at monitoring or compliance within an organization. Next. So there are 9 sections within the survey. and they focus on the child and family team, family-driven practices with the family, and there's also a section that looks at family-driven practices when a youth goes into a temporary foster care or guardianship living arrangement. There are youth-guided practices that are surveyed, cultural and linguistic competence, entry admission to a residential intervention, what occurs during a residential intervention, what occurs post-residential intervention, what the community system of care looks like, and performance and evaluation within that system of care, which really focuses a lot on data that an organization is utilizing and incorporating within its best practices. Each of these sections has probably an average of 8 to 10 questions within it. Lots of them have sub-questions underneath it. And as you saw in that example first page, there's a series of questions that individuals will respond to as they go through the survey. Next. So some key facts. The survey takes about 30 to 45 minutes to complete in its entirety. Some organizations have found it will take a little bit longer, some can get through it quicker, and depending upon what sections you're completing, it can be done in a much shorter period of time. But if you're doing the entire survey, all 9 sections, I think one should allow at least 30 to 45 minutes to complete it. There's a glossary that defines terms used in the instrument. I'll talk about that a little bit more in a moment. Tools request information about the role of the respondents. So each person that's completing the survey will be asked to identify what role they have with the residential provider. Are they a youth? Are they a family member? Are they a direct service staff? Are they in a management or supervisory role? Are they an administrative role? Are they a parent or youth peer partner? Are they a community partner? Or do they play some other role within that organization? And by identifying what those roles are, we are able to do data analysis. And when I talk about the results and analysis, I'll delve into that a little bit more about how we can break down some of that. There's also a consent statement that guarantees that responses are anonymous and confidential. So that really needs to be acknowledged by any respondent, and the organization really needs to honor that all responses are really treated anonymously and confidential, unless an individual decides to share their name or email address with the organization. So again, the tool is used to stimulate and guide and direct improvement of immediate and long-term outcomes of a residential intervention. It can be used with either a single organization that wants to use the SAT, or it can be used with a number of organizations that want to be part of a quality improvement collaborative. Some oversight agencies that are working with a group of organizations may want to use this to really look across a number of organizations within the jurisdiction of that oversight agency. Next. So there are 2 resources that go with this. There is a glossary of terms and there's an instruction guide. The glossary of terms really identifies any term that's used within the tool. And to make it easier for respondents to understand the terms, at the head of each of those 9 sections, there is an identification of what the key terms used in that section are. And then there's an instructional guide. Next. So the instructional guide really provides an overview of the tool, how to use it. It delineates decision points for administering that tool, and it outlines implementation strategies and offers approaches and key questions for interpreting results. Next. So some of the key decision points that need to be made are, is the survey going to be used in its entirety or sections? Some organizations choose to only do a couple sections. It might be the child and family team. It might be around family involvement. So you can decide whether you're going to use the entire survey or just parts of it. You can also decide whether all stakeholders are going to be surveyed or just select stakeholders, whether the survey is going to be completed individually or utilized in group sessions where you can have a group of people do the survey at the same time. It could be a single point in time, or it can be done in intervals. In essence, a post session and follow up perhaps a year later to the original survey that you've done. And they can be done either electronically or by paper. So next. Implementation can involve a project manager, administrative support. You need to identify who your respondents are going to be, how you're going to contact them, whether that's through email. Someone needs to have consistent communication with them. There needs to be survey dates. Creating a sense of urgency is really important to getting it completed, and providing ongoing support throughout the duration of the survey is really important. So next.
Thanks, Bill. I'm going to briefly provide an overview of SEO Family of Services, a journey towards building a culture of family-driven and youth-driven care. Next. So SEO Family of Services is one of the largest nonprofit organizations serving individuals in New York City and Long Island. We have about 84 programs in 120 locations, and we have a continuum of services, everything from early childhood, child welfare, including foster care and preventive services, youth justice services, educational supports, homeless services, developmental disability services for the people with developmental disabilities, and also those who require behavioral health and substance abuse. Next. So I'm going to just go over a little bit about how did we even get to a place where we wanted to look at, family-driven care and coming up and youth-driven care and coming up with what the culture should look like. Next. So I always like to say that, it's important to understand your why. And our why just came from our president and CEO, Keith Little, and he issued a challenge to us. So when he came to the organization about 3.5 years ago, he came up with something that we all affectionately know and tease him about as the 3 Ps. And really, he used those 3 Ps constantly in every single message. And it's really about focusing on performance, looking at positioning. Since we are a large organization, how do we position ourselves to really leverage the services that we have? And then what types of partnerships do we need to really build? The second piece was that he really talked a lot about moving away from our organization being one of those that sets up what I consider tents in communities, and really kind of just moves into a community, tells the community, we're great, why don't you come and work with us? And so he really wanted to focus on working in communities versus working with communities, versus working in communities. And so that was like a really big paradigm shift. The other thing is we also started to focus a lot around diversity, equity, and inclusion. And one of the things that is really important to our organization is that if we're really looking at true equity and inclusion, that means that we really need to provide not only access for people to truly tell us whether it's good, bad, indifferent, what is happening, and also really help to design what their needs are. So people need to be able to help to co-create with us. And so this was our why. We really wanted to make sure that we were working with people instead of in communities, and that really we wanted to provide access and really listen to the needs of our residents and their families. Next. So how did we go about this? Well, the first thing that we were fortunate to have is we were fortunate to be able to receive technical assistance from Building Bridges Initiative. And we were able to, through a grant from Ridley Horowitz, Building Bridges was providing us with the support that we needed and the education that we needed. We just couldn't come up with, okay, so now we're just gonna have focus groups. We really wanted to have meaningful exchanges that led to some type of action and systemic change. So we needed the technical assistance and started to attend and think about the principles of what family-driven and youth-driven care looks like. The second piece is that we decided that we were going to use the self-assessment tool. And we really kind of looked at the tool and tried to identify what is it that we really wanted to capture, and what is it that would really kind of help us to pinpoint what is the feedback that people have about being in our residences or even our services. So we decided to use the child and the family-driven piece of it, of the self-assessment tool. And we started to assess in our first year of the pilot program, we started to assess one of our mother-child programs. And I'll talk a little bit about that in a later slide. Then also we wanted to look at how do we make it happen with others? So if we're really truly going to educate ourselves, develop this assessment, then how do we get others on board, right? How do we get others even prepared for the feedback? Because people are often don't want to take assessments because they're afraid of the feedback that they're going to receive. So how do we get this together? So we really had to take what our CEO's message was and really think about what are some creative ways that we could get everyone on board. So one of the things that we did, and I'm so happy that Nancy mentioned it, that question about what if, we started to kind of work with our communications person and talk about and do actually a campaign where we had little snippets of what if we had all families or reunited? What if all children received permanency? What if we had people talking to one another about services? And so we really had to make a conscious effort about really getting people on board. The other thing that we did is we started our survey with our executive team. If our executive team doesn't understand what family and youth-driven work or culture looks like, then, I mean, it's all going to trickle down from there. So we decided that we were going to use the assessment with them first, and then also use it with our administrative staff, and then also use it with our families. We wanted everyone to be on board and prepared. Next. So everybody loves a good acronym, right? So we came up with this acronym to really focus on with. And so our working with communities, the acronym, it's work innovatively together to transform healing. And so this is where we decided to concentrate our efforts, is how do we work innovatively together to transform healing across the board. And you'll see our first pilot with Building Bridges is that we focused on our mother-child program. And some of that was because there were some challenges. And because we were also receiving technical assistance, we decided that the best place to be curious was to really look at, are our teen mothers, are they getting the services that we say they're getting? Are we really using a generational approach? Are we really inviting them to weigh in on program? And now this year, we are focused on our LGBTQ agency operated boarding homes. And we have done the self-assessment tool with them. And we also have done the self-assessment tool with our children's center. And I would say that these are very unique programs because one is that we wanted to really identify with these specialties that we have, are we really specialists in these areas? Are we really listening to our children? Are we actually asking them to co-create with us and partner with us? And also, are the families getting what they need to really sustain reunification and permanency? Next. So very quickly, some of our lessons learned is you have to have an investment. If you're not invested, and if everyone in the organization is not invested, it's going to fall flat. Also, the other thing is that you got to be open to hearing things that you might not like. And then the other thing is really identifying who your stakeholders are. So we consider our stakeholders, our families and our youth. We consider our stakeholders also those that fund us. And so how do we also get them involved in the planning, and also how do we get them involved to provide us to get interested in also doing the survey. So the second time around, we wanted to make sure that our community providers were also answering the survey as well. Next.
Jennifer, thanks. And I've appreciated the opportunity to work with you and SCO, and the importance you identified of leadership being involved, I think has just been crucial as BBI has really worked with SCO around this. And I think your CEO and your leadership has really made such a difference in being able to implement the changes that you've identified. And that came out of looking at the results from your surveys. And I want to talk a little bit about how one can go about looking at results and interpreting it. So after the administration of the SAT and when it's closed and done, the results really need to be summarized and analyzed to identify strategies for what you're going to tackle and what you're going to focus on. The other thing that's so important is really to broadly share with stakeholders and partners the results that have come out of this survey. If you've asked people to take time to participate in it, and then they never hear back anything from it, it's just wasted time on their part. They really need to know what the results are that were achieved by the organization in terms of looking at this. And sharing that with people that completed the survey, from my perspective, is just crucially important. There's a process that BBI likes to use when it's involved in helping an organization implement the tool and do the analysis. And it really starts with a consultant from BBI working with the senior leadership team of an organization. So we would have a call or a session, a Zoom call, where we really sat down and explained how to look at the results and how they're portrayed and how to interpret the results that are there, and share from BBI's perspective what we saw as strengths and opportunities for improvement within the organization, while also encouraging the organization to even dig deeper than we have in terms of looking at it. Once we've shared this with senior leadership, we would then ask that senior leadership to take those results and share them with leaders within the organization. So that we really start with leaders, and I think Jennifer said it well, leadership needs to be on board, and leadership needs to understand what the organization is focusing on and what it wants to achieve. So understanding results from leadership is crucial before you start sharing it with staff, with families, with youth partners. And then those leaders should be the ones that really go out and share that and are conveying the information. One of the things that when we do the survey electronically, we have the opportunity to do is really share the results broken down by specific data pools. So we can look at just responses from youth, or just responses from families, or just responses from social workers. So we can really delve into that if an organization really wants to dig deep into the kinds of responses that they receive from the survey. So next. So interpreting the data and using results entails a number of different activities. It really starts with aggregating and analyzing the range of responses within and between groups. So you can delve within a group and between respondent groups to really look at the data that you've received. You can identify the differences in responses to really understand really where some of the perceptions are within different groups about the organization. I think often as leaders in an organization, we may see things a certain way that are not necessarily how others are perceiving it. And we really understand through the responses that an organization gets where those differences might exist. So it really offers an opportunity to involve respondents and partners in discussing the results and drilling down to identify opportunities for improvement. There are a number of questions you can really address when you're having these discussions. Where are the differences in ratings? Do particular respondent groups differ in their responses? What are the likely reasons for some of the differences in these ratings? To what extent do practices differ between groups or individuals? Your direct care staff, your clinical staff. Where are opportunities for growth and improvement that we've seen from the responses? So all those are kinds of questions you can really delve into in having discussions as you present the results back. And then obviously planning and implementing change suggested by the results and the stakeholder discussion process. So next. So I want to give you a few examples of when we use a SurveyMonkey process, what this can look like. If an organization does the survey on paper, it can make arrangements with BBI to have those paper results put into a SurveyMonkey, and then you would get a result back that looks like this. Or if you use a SurveyMonkey instrument, that first page that I showed you would look different because it would be in a SurveyMonkey format, and we are able to analyze the data. But what you get are some different views of the data, and this is the first example I wanted to share with you. So several things are happening on this slide. What you see is the question that is being asked. So the question is, staff are trained in culturally appropriate and responsive and trauma-informed and responsive practices for engaging and involving families in family-driven practices. So that's the question that people are responding to. 43 people you see answered this question. Lots of times people may skip a question because they don't know an answer to it. If there were skipped responses, that would show up in that area. And then we've got a couple of different presentations of the data. We've got the visual presentation for those visual learners, and we've got the data broken down in percentages and numbers for those that are much more analytical in understanding the results. So as you look at this chart, what you see is different colors that are presented in terms of the responses. So there's no green, there's no blue, which means that no one said that this never or rarely occurs. Everyone said that it's sometimes, often, always, almost always, or for a few people, they didn't know whether it occurs within the organization. So if I was looking at this and giving feedback to an organization, I would say you've got 81% of folks saying that this always or almost always occurs, with another group of about 10% of people saying it often occurs. So that really says this is an area that is really a strength for this organization in terms of what they're doing. So if you get into the analytical data, you'll see by each response exactly how many people answered each question. So 2 people said sometimes, 4 people said often, 35 people said almost always, and 2 people said they don't know. And that adds up to the 43 respondents that you see. So next. Another view of the data is really a pie chart. And this gives you a different visual of how the information is there. So this question is about residential staff continuing to serve on the child and family team following discharge. And in this one, you see that there were responses for each of the 6 categories. 7 people said almost never, or almost never does this happen. 5 people said it rarely happens. 6 people said sometimes. 7 said often. 9 said always or almost always. And there were 9 people that said they didn't know. So if I were giving feedback to the organization, I would say there's some opportunity here for you, because about 50% of the organization responses were around always, often, or sometimes. But equally, 50% of the responses were rarely, almost never, or they don't know. So I would want the organization to dig in and delve in to this question a little bit more by asking questions of the respondents about what this means to them and why, and how we can improve in terms of this area. So next. The last version I'm going to share with you is really a way of showing a multi-component when there's a question. So in this, the question is family members of current or former residents are, and then there are 4 subparts to it. Employed as staff, employed in management, or represented on the board of directors. And again, we use the same colors always throughout the responses. You see that there are a lot of people that are either in the green or purple area. So again, just looking at the bar charts of the 3 that are here, you really say there may be some opportunities either for more education or as an area for improvement activities for the organization around this. Next. And again, the last question is volunteering within activities and or events within the organization. And you see similar responses. There's a large 50% of people really don't know about that. So when you're having discussions with your groups about this, it's really an opportunity to talk not only about their perceptions, but also about what the organization is doing and what's happening within the organization. And again, for those that are more analytical, the breakdown of the numbers in the percentages and respondent numbers are there and available for you. So next.
Thanks, Bill. And Jennifer, you did unbelievable. I just love the work you guys are doing there on family-driven and youth-driven practices about the whole agency to do. So let's talk a little bit about, what did we learn by using this wonderful tool? I've done the tool 2 or 3 times in my lifetime so far, and with different agencies. So we want to make sure that we're focusing on those who want to give us the feedback, right? Sometimes we chase those who we think need. So let's, it's a lot of work. There's a lot of people, as Jennifer said in her agency, 66,000 kids and families you served. That's a lot of family perspective. Sometimes the survey could be too long. Especially if you're looking at the family-driven side and the youth-driven side. When the tool was developed, lots of family members gave great feedback. Lots of youth gave great feedback, but it doesn't cover, 100% of those doing it. And this is where I get to introduce my most favorite topic, having a family partner. To help those, and a youth partner to help those family members and youth to be the interpreter, not to guide that, not to tell them how to answer, but to make sure that they understand what it is they're answering. And I think that sometimes, as Bill shared, could be interpreted on why we're seeing we don't know, right? Could be, not necessarily. You got to dig a little deeper. We want to make sure that have focus groups to do this. I love that you can do the tool in a manner with a whole group. You just bring people together and we do it together. Then it's not calling me out as a family member. Part of this is, you have to have buy-in. So as Bill shared, and this is, again, sometimes you could just be me. If I could only be you. We have to have buy-in from families. And when families are asked, they want to help, but they also want to know what you're doing with all of this information I'm helping you with. So you have to feed it back. I want to know if I spend all my time, and not just the 40 minutes that it takes to do it, right? That I want to be part of the solution for the agency. That's why I'm there. And we have to think about when we're using this tool, it's a journey, right? It's about a journey, not the destination. It's not how fast you can get thousands of people to do this. It's about looking at why we're doing it and moving along in that way. Sometimes you can give incentives for folks to do this, right? Especially if you're doing your staff, right? Like, oh, here's another piece of paper. I have to fill something out. And they zip through it very, very fast. I'm going to go back to it's a journey. So we want to make sure that our staff have time to participate in that. Don't rush the process. Have time frames and deadlines, but it's about the quality you get and making sure, as Jennifer so lovely pointed out, hearing their voice with them. Next. Oh, yes, okay. It's on the slide. Let's see, I think we can do, don't rush, we can do next. I was reading my notes. So we love this little interpretation, right? What you're trying to achieve by doing these tools, by starting at the beginning, is hard. It's really hard. And everyone, to be successful, everyone has to be willing to hear and do things that make them uncomfortable. My job as a family advocate is to point things out. I don't like it when people point things out to me so well, but I hear that creative feedback and I look within myself to make that. Change is really difficult, but if everyone, as Jennifer said and Bill said, if everyone works really hard to accept, they can flip what they're doing today and they can implement, activate, and adopt the change. Those are, I wish they were all A's. I got to figure out an A for the implement, that I could have the 3 A's and Keith will have the 3 P's. But we expect that residential program has to, be fully incorporated youth and family voice, or it won't work. If we don't include everyone, and I go so further to say that includes the maintenance people, the guys that are cutting the grass, the housekeepers, the cooks, everyone should do the SAT, because that will give you a view to help you as an organization. Actually, that's good, Rob, thank you. That will be able to give you a vision and a mission to lead to. And next. That's Bob, you're on mute.
Got it. Thanks, Nikki, for those outstanding comments. I'm going to quickly now, in the few minutes we have left, cover the other 2 tools that we mentioned. All of this was about the SAT with an example of an agency that's using the SAT to really transformational effect, actually. So I'm going to talk first about the post-discharge outcomes survey. And here's a little look at what all the pages look like. Next. Thank you. So what we did was we looked at how can we assess what's happening post-discharge. We put together the survey, and it was study of discharge function in 6 domains. I'll go over those domains here really quickly. We put together a pilot study, but one of the things we wanted to do was just avoid the confusion of were we studying the actual the residential impact, or were we studying whether it's even feasible to get the data. There's been a lot of thought in the residential community, I think less so than it used to be. I've been doing residential involved for 45 years or more, that really couldn't get post-discharge data. So we designed the survey in the 6 domains, and we vetted it with family members. We had family members involved in the construction of the survey, and then we did a pilot study. And the study was designed only to assess the feasibility of collecting the data, not to analyze the data we actually received. So, and what the study did establish is that, yes, it is feasible to collect post-discharge measurements, and offered some tips and strategies about how to do that. Next. And that study was published. We're going to show you the citation for the publication, and the website has a summary of the study in a practice brief, the BBI website. So when we developed the survey, we looked at the tools that are out there. We received input from family members, from youth, from key stakeholders from around the country, and we established these domains for the post-discharge survey: living situation, school/education, employment, various risk factors that youth experience in the community, the level of community engagement and support that the youth was experiencing, what treatment they were still involved in, and their access to resources in healthcare and counseling. And we pilot tested this with family members to see if it would work for them before we actually did the study. Next. So this is a summary of successes and challenges. We found that actually this is about 25 or 26 item survey. It's done telephonically, and it took only about 10 to 12 minutes to complete, so it wasn't a significant time commitment. We found that most caregivers are knowledgeable about the youth 6 months post-treatment. We say caregivers, we mean family members, but in some cases there were foster parents or other people involved 6 months and not the family. Caseworkers and other service providers were interviewed if there's no caregiver, and we had a really nice response rate, a 60% response rate on this. Some of the challenges with the caregivers, in other words, family members and other folks taking care of the youth, may be difficult to reach during daytime hours. And there was no survey option for emancipated youth, and we actually did address that challenge. One provider withdrew because of limited capacity. They were a small provider, so that gave us a little bit of a snapshot that for smaller providers, it might be a little bit more difficult to actually get this information. And we saw that variability in response rates between the agencies. What we did in terms of the no survey option for emancipated youth is we created a young adult version. This is for youth 18 years and over. And there's like a little statement at the beginning of the survey to kind of limit its use in Massachusetts. Next. Next. Are you hearing me? Next. Oh, darn. I think I'm having an internet problem. Oh, here we got next. Thank you for that. Sorry for that little bit of internet confusion there. One thing you can do with the post-discharge survey is correlate it with the SAT. So we can see, okay, what items seem to, how's the youth doing 6 months post-discharge, and how does that correlate with what we saw in the SAT in terms of the various practices that were being made available to youth. The degree of family-driven, youth-guided, culturally and linguistically competent services, et cetera. So that could be used for quality improvement purposes to correlate the data. Next. Next. So the resources in order to use the post-discharge survey, we need that leadership commitment at the top that Jennifer talked about, Nancy's talked about, Bill's talked about. We need staff resources in order to make the phone calls. Sometimes we can do this with overnight staff. Sometimes we can do it with therapists. Sometimes it was done with other case management kind of staff, or even administrative, like reception staff. We want to make sure we have accurate contact information in our file. We want to be flexible about when we're calling. And there's additional possibilities to get a nice, robust response, creating an incentive, Can use stratification designs to yield representative responses from different youth, and a response non-response analysis to test for bias. And that's a little bit more sophisticated than we have to go into right now. So one other thing we learned is that family members want to help. And so informing family members at intake that we might be contacting them for a post-discharge survey, getting their involvement in the process from the beginning, getting their involvement in measurement was a recommendation. Actually, Nancy was part of giving us that recommendation, and it's part of one of the recommendations that we do make in this study. Next. Next. So I'm going to move on to the final tool. This is the readiness assessment. Here's a picture of this. Let's just go on to see what it looks like here. It's another Likert scale, not established, under development, partial implementation and full implementation of these various items across 6 domains. And the idea here is we learned from the feasibility study that some agencies weren't ready to collect post-discharge data. And so we were asked actually by a couple of the agencies, there's an assessment that would help us know what to do if we want to move further into the measurement field. And we worked with Chapin Hall, which also worked with us on the post-discharge outcome survey to develop this readiness assessment. Next. So its purpose is to help organizations identify areas of strengths and weaknesses in their capacity. This is really a capacity assessment. It's not intended for any kind of compliance. It's not intended for benchmarking or comparison between organizations because it is really such an individualized process. But it is designed similar to the SAT and what Bill was talking about to prompt discussion among staff, stakeholders, and management regarding as a provider, where are our current capabilities in specific domains of readiness. So we can facilitate a plan of improvement moving forward, assuming we want to measure more, assuming we want to understand our processes more. Next. So we define readiness as the ability to maintain contact information for families, other caregivers, and youth 6 months post-discharge, to gain the necessary consents, to collect accurate outcomes data 6 months or longer post-discharge, to aggregate and analyze that data, and to use post-discharge data to improve practice. So these are the components of readiness. Next. Here are the domains that the survey covers. Organizational culture, there's a culture support measurement. Leadership support, leadership at all levels, from the top through the mid management level, and also leadership, thinking about leadership that even the frontline staff might provide. What's the staff capacity? What are the staff strengths? What are the staff skills? What kind of capacity do we have to do post-discharge measurement? What are the processes we have in place to collect data, to manage data, to analyze data? What workforce development needs might we have? What do we have in place to help staff learn some of this and to develop our workforce to be involved in measurement capacity development? And where's our technology? Does our technology support this kind of measurement effort? Next. So the tool has 39 items. It's meant, similar to our other tools, to be completed by diverse agency staff at differing levels of the organization. All those levels are noted there. Family members and youth, of course, and stakeholders, community folks as well, if that seems appropriate. It's completed as a team or individually. This might sound familiar. It's the same thing we talked about with the SAT. And it results in the organization developing an assessment summary and plan. It doesn't have criteria to say, here's your score and here's what you need. It's more like, how do we understand the data we're getting? What do we make of that? And what should we do about it? Next. So the next steps in our data-driven practices and tools is we are encouraging the use of these tools. We want to begin collecting the correlations between practice level data within and across organizations. We have a vision of a repository of data. We have translations into Spanish we need to complete. We have some of those done. We want to encourage measurement of organizational capacity and readiness to identify resources and barriers to successful engagement. But the big thing that we want to do is a methodologically sound research strategy, so we can look longitudinally at what is the residential impact and control for the variables that might happen between a residential intervention and 6 months post-discharge. So we want to be able to study that in a way that's methodologically sound, and we can look at the impact of residential. That is a big, big project. We're working on The scaffolding for that project was to develop a well-articulated theory of change. So we're working on that right now. We're going to be presenting on that at the ACRC conference in Florida in August. And in doing that, we're using the ecological theory and the contextualized approach. What's the theory of change for the family and youth, for the provider, for the community, and for the system in which residential sits. And we're also kind of taking some cues from the Patient-Centered Outcomes Research Institute, which talks about ground up kind of processes and involving everybody in the measurement. Next.
Thanks, Bob. So I get to kind of get us close to the edge here, to the end. Maybe the edge is the right word. So what are we doing for next steps? Well, I would say go back to what if? What if you did the SAT? What if you had ongoing communication, even if it's a short, fast email to the families up to that 6-month post-discharge? What if would happen if you could do that? That families are more apt to answer your questions if they feel like you care about them, right? We want to be part of the solution, not just the problem. We want to have ongoing communication with you. I, almost 15 years after my son was discharged, still have communication with a couple of the staff that he worked with him, because they gave of themselves and continue to give and continue to reach out and say, how is he? What's he's doing? You know, one of the most important roles that families can have is a connection to someone else just like them. So what should you prioritize? If you don't have a family peer partner in your agency today, I would say you need to employ one. You need to look at making sure that there's youth and family representatives on your board to give you feedback. You should make sure that you have a youth council and a parent family advisory to make sure. Our young people, they have a lot of people helping them. Make sure that that help comes into my home to help me. Families measure success by self-efficacy. They should be able to share with you at the end, at this discharge, 6 months later, what you taught them, what you coached them, and what you mentored them to self-efficacy and empowerment. That's my what if. And I will charge all of you that are listening today to go back to your agencies and try one what if, just one thing you can do today to implement that will move you towards data that will change your organization. So thank you very much on behalf of myself and thousands of families that are involved in residential intervention.
Okay, we have a few questions that I just want to throw out to the panel. First is, why use the term residential intervention?
We wanted to get away from a few other terms that are commonly used. Residential treatment is confusing because treatment happens within a residential facility, a residential setting. The residential is part of the treatment in terms of what's happening, what kind of environment do you create, but it doesn't necessarily speak to it. And it's very hard to collect data to say, you know, what is residential treatment? What is the impact? What are the outcomes of residential treatment? Because it's such a complicated service. So we wanted a more all-encompassing term. Residential care is very commonly used. Many family members experience that as the residential program cares and we don't. And quite honestly, that was the case. They had reason for having that experience with some programs, unfortunately. Then there's residential. So residential placement means that the kid is now placed and they're living there. We wanted a concept that would say this is an intervention for a specific period of time for a specific purpose. So we can get away from the 2 years length of stay that may not be necessary. or even the 1 year length of stay that may not be necessary. It's not a placement. It's not a place for the kid to be housed, for the youth to be housed. It's an intervention for a specific purpose, for a specific period of time. And then it's all encompassing. So the intervention happens within the program itself. It happens in the home. It happens in the community. And the values of what we want to introduce into the intervention are the values we've been talking about, the kinds of practices. But it's essentially intended to connote that yes, we need to send the kid to residential for a period of time, but it's an intervention in a longer journey that the child and family are on, and how we're going to work with the child and family and the community so that when they can leave the residential program, their progress continues, and it doesn't become, for many youth, feeling like falling off the edge of the cliff, which is what many youth did let us know in my agency about their discharge experience. So that was all the reasons that we moved to the term residential intervention, connotes community and residential together. And I know in my agency, we found that very, very useful.
Thank you, Bob. I'm wondering if you could actually answer the other question around the BBI resources and the books that came up in the chat today, the name of the books.
If we go up, I think one slide, we go back one slide, Gary, and the names of the books, there they are. There's a picture of each of the books, and there's the name of each of the books. And if you want a link to order the book, you can email me. My email's at the end. I'd be very happy to respond and send you a link straight to the publisher. I think it comes with a discount. I'm not sure if I'm supposed to say that, but we can't advertise discounts here, but we can say, here's the books that you want if you want to try to access them. You can get them on Amazon.
Thank you. Thank you, Bob. Additionally, there was a question, I think you answered it in the chat, but I just wanted to make sure that folks knew that about the tools and whether or not they're proprietary.
No, the tools are available open source on the website. And so there was a previous page in this set of resources that had a bunch of links, and you can get that. I think if you go to the YouTube link that was provided up in the chat box, you'll be able to see all the links here. Again, you can feel free to email me if you want me to send you that page with all of the links, but you can go to buildingbridges4youth.org. So buildingbridges4youth.org, no spaces. And you will find the tools, you will find the various documents that were listed, the documents on building consensus measures, excuse me, really good tip sheets for, here I am, my organization in Oregon. How do I get a measurement capacity established? You know, I feel like we're ready, but now what do I do? And so there's a lot of really good tips for how to get the design going. That's all on the website. It's all open source. For the SAT, we really do prefer that people come through BBI, and that's the way to access the electronic version is to do this through BBI itself on the SAT. But all those tools are available on the website.
Great, thank you. I have a couple more questions. One is, what have you found to be the most effective techniques organizations have used to encourage responses?
Any other panelists want to weigh in on that?
I'll respond to that. I think the one that stands out the most for me is communication from the CEO. This really needs senior leadership backing if you're going to be successful. And I think the CEO, executive director, really needs to be communicating with staff that this is important to me, to the organization, and getting that message to staff, to families, out to youth. We've often helped organizations craft messages from the CEO that can be geared towards families, towards youth, and towards their staff. So I think BBI can really help an organization craft those kinds of communications. I think secondly, consistent reminders to complete it. It's sort of like in helping a youth get to permanency, we really want to create a sense of urgency. And if you want something done, you really need to create a sense of urgency. I think Nancy talked about it well. You're not pushing it, so you're pushing it, but you at the same point want a deadline, or we know that it gets to the bottom of people's to-do list and can get pushed off if not there. Part of the reason I like doing it in groups is the fact that you're creating space to do it. If you have a family event why not have an opportunity for families to sit down and do the survey while they're all there for another event? A lot of organizations have used a lot of creative things, iPads. A family comes in, hand them the iPad with the survey on it. If you're just doing some sections of the survey, it will only have those sections on it. It doesn't have to have the whole survey there. So I think, those are, I think, just several of the things that can really be used to kind of enhance and encourage responses from families and youth. And Nancy talked about incentives. I think incentives are great. I've seen many organizations use those with not only their staff, but also with families. Movie tickets, a $25 gift certificate to a grocery store, lots of different things that can be meaningful to families. I've also seen folks do group activities with youth for completing it. So I think there's a lot of creative ways that you can really enhance participation response rate with the SAT.
Thank you. What type of response rate on the SAT would be considered desirable?
Yeah, it's a good question. I think we'd like to see about 20% or 10 families responding, whichever is larger. And I think the same number for youth. 20% or 10 youth if it's a larger organization responding. I've seen organizations with 50 people, 50%, of youth responding, which is just fabulous. And that a lot of encouragement has gone on to get that. I've seen a little bit more challenges with families. I think lots of times families don't know, and that's why having opportunities, as Nancy suggested, to do it with folks present, using a peer support partner to be with them, helping them if there's any questions they have in interpretation, I think can enhance family response rate. And staff, again, incentives work well, I think, with everyone. So I would say that anything you can do to encourage responses gives you better sense of people's perceptions of really what the organization is doing in each of these different areas surveyed.
And Bill, I just want to add to that a little bit that, making sure that families know that this is anonymous. You don't have to put your name. You don't have to put any of that down. You're going to get what you're looking for. And sometimes we have a tendency, because we send it to those who have more communication with us. We need to outreach to those families and those youth who, seem like, oh, well, if I do this, okay. If I don't, okay. What's in it for me, kind of thing. And I think those are the ones that we want to show they have value. And sometimes in residential, families and youth don't feel their value. They feel like they're just being shuffled along. And this is a perfect opportunity to say, your voice will change us. It might not get a lot of change all at one time, but it will make us better for the next youth and the next family that will come. And that is a driving force. That's how I got into this work. I want to make it better for the next people. Thank you.
And Nancy, I think Jennifer really demonstrated in her programs how youth voice can impact change. And we really saw youth saying that they didn't have input into certain things they wanted input into. Staff heard that. As they heard that, they created those opportunities for youth. So it's not only benefiting youth that are there today, but it will benefit youth down the road in the future. So that voice is really critically important.
And for organizations thinking, just jumping in on this, wondering about family engagement to be aligned with the requirements for qualified residential treatment programs in the Families First Act, engaging families in this measurement process from the point of intake is a great engagement strategy. We've had organizations report back that they talk to families either at intake or sometime during the residential intervention, and they were involving them in helping design measurement or in completing the SAT. And then the families, as Nancy was saying, they feel like their voice is important and they become very engaged in the program, and it has a lot of then implications that spread out from there.
Thank you. I'd like to offer each of you a chance to offer any final thoughts or comments.
I guess I'd start. I'd say that I've had an opportunity to work now with a number of organizations, including my own, way back when I was working in an agency. And having worked with organizations that have used the SAT, I think everybody has found new insights into their practices. There's something that's come out of that survey that was very informative for them. I think leaders often have perceptions of how their organizations operate, and those perceptions are not always aligned with how others see that organization. And I think the SAT provides a great opportunity for leadership to see other perspectives, those of family, those of youth, those of their staff, that may not be aligned exactly with how the leaders are perceiving things to be. And I think that makes the tool very powerful for an organization.
Thank you. Anyone else?
Yeah, I was just going to say, from a provider's perspective, I think it's really important to take the risk. You know, families and youth have a lot to say. And sometimes we don't really consider their voices, or we don't do our best to amplify their voices. And so I would just say, take the risk. The tool is something that can really help to facilitate meaningful dialogue. And so it's not really about just, you know, doing the questions and then it's like, okay, let's put that in the drawer. It's really a tool that actually can transform and also really develop a partnership with your families and youth.
And I'll go and let Nancy finish because she finishes so beautifully. We really used the SAT in my organization when it first came out, which is around 2008 or 2009, back in there. And it had very significant transformational impacts on us. We had just hired our first parent partner with a grant, and she kind of shepherded our families. We had parent groups, and so they'd come in the evening time, we'd have pizza, and she shepherded them through filling it out as a group, actually, with incredibly rich dialogue, and then would call me in to hear directly from the family members what they were seeing, which was a disconnect from some of what I knew, as Bill was saying, from their perceptions. It had a significant transformational impact on us. You know, looking at the latest work on patient-centered outcomes research, ground up participatory kind of field-based research, that kind of work. These tools really help do that. And there's always a time consideration. Do we have the time? Do we have the resources? And from my point of view, taking that risk with the time is, do we have the time to not do this? What are we spending our time on, and how can we really think about spending our time differently in some areas so we can invest some time of leaders, of staff at all levels of the organization, engage. They have a stake in it. It's their lives. And what a better way to spend time and make improvements.
Thank you, Bob. I think you're fading out. So we're going to move to Nancy.
My last comment would be, think about what our family's life would have been like if someone had asked me, what if, 15 years ago, if someone had had this kind of a tool that could have made the impact and the humongous changes that organizations make every day using this tool. But know what? We didn't have it back then. We have it now. So why wait? So thank you very, very much for giving us the time and your energy to make a change in every family's life, not just one at a time, but all of the children and families that you touch, and the young adults as well. Thank you.
And thank you to our outstanding presenters, Robert Lieberman, Nancy Craig, Jennifer Outlaw, and William Martone, for sharing their expertise and strategies with us today. And thank you to our interpreters, Levi and Dawn. And thanks to all of you for joining us for this segment of the Training Institute's Live. We would appreciate you taking a few minutes to complete the evaluation for this workshop using the link that is posted in the chat. We take your feedback seriously, and it will help us to shape the upcoming series. As a reminder, this summer, take us wherever you go July and August workshops will be released the first week of each month and available to you all month long. Listen and learn to select workshops of your choosing or listen to them all. The link to the workshops on the website is posted in the chat. Again, thank you for joining us today, and we look forward to seeing you wherever you go in July and August